So government has put its vaccination drive in high gear this weekend as the country records an alarming increase in COVID-19 infections. At the same time, health workers are raising the alarm over the high number of young children being hospitalised with the Omicron variant. To discuss this further, we're joined now by Pulmonologist Dr Emmanuel Taban from the Mediclinic Midstream Hospital. Dr Emmanuel, thank you so much for your time this morning. Can we just speak a little bit about the impact that Omicron is having on particularly young people?
Thank you very much, Faith, and the viewers out there. Yes, I think it's very unusual because in the past we haven't seen really a large number of children. I mean, if you look at our hospital, for the last 48 hours, we have almost like 12 children that come tested, and almost 8 out of 11 tested positive for coronavirus, and that was very unusual. I mean, most of these kids are less than 10 years old, and in the past. That was, it was only really an adult disease. So, but the question that whether it's actually those children present with severe disease was really most of the children actually come to the ward and they're just in the ward for 24 to 48 hours, but they're also having other viruses. It's not just coronavirus alone, but other viruses that come together. So for me, yes, the number of children has increased, but I don't think we should panic about that because you might just remember most of the children under 10 years are not vaccinated. And that's probably the reason why they're testing positive.
Yeah. So in that regard, I mean, how does one actually contain the spread? Because if it's amongst children, and as you're saying, some of these kids have had to be hospitalized, how do you contain it? The child can pass it on to the parent, and that obviously is the knock-on effect.
I think it's going to be a vicious cycle. But as I said, the Omicron virus has been it's a mild virus, actually. If you look at the number of the cases, I mean, last 24 hours was reported that there's 16,000. You could actually triple that or triple it by 3. So almost maybe there's 60 to 80,000 cases around the country because what we have known, those are patients that have tested, but I know families that have tested, only the father tests and the rest haven't tested. So probably the number is higher than what they expect. But I mean, if you look at our hospitals, the hospitals are all empty. It's not like fully flooded. And my ICU, I don't have any covered cases except the 2 old cases. So I think we shouldn't panic about the new variant. Yeah. I think, yes, most people get infected, but I think probably just mild symptoms. And most of them actually don't need hospitalization. Most people are quarantining at home just with a kind of symptomatic management. So I don't think I really would panic about that. I think life should just carry on and people must just use the normal precaution like wearing masks, isolating, and also make sure that they sanitize.
Yeah. I mean, when it comes to, for example, the reports coming out that Tshwane, I mean, it's been deemed as, let me repeat, the global epicenter of the Omicron variant. I mean, to be known as a global epicenter of the Omicron variant is no small feat. So in that regard, what do you think is happening in the city of Tshwane?
I think the situation has been exaggerated out of context. I mean, yes, maybe the numbers are quite high. But the question, I mean, if you look, I mean, yes, many people might have Omicron virus in the society, and the cases are huge, yes. But I mean, that does not translate into infection, into kind of a complete sickness that require hospitalization. I mean, again, if you look at the number of hospitalization, there are quite very few cases as compared to previous with the Beta and Delta. So yes. The numbers are going out. I think we expect the number to go out countrywide as time goes on. But the question that I don't think people should panic. I think you just let's not be dramatic about it. I mean, we can contain the infection is quite contained. Yeah. It's not that is mild. And I think for me, that's really the most important thing. I mean, a hospital, we're not like having pressures on the hospital at this moment. So
it's not so bad. So then, Dr. Emmanuel, very quickly, are we saying that even those that are unvaccinated are displaying symptoms that are mild when it comes to this Omicron variant, or is it different for them in terms of how the virus presents itself or the variant of the virus presents itself to those that do not have a vaccine?
In my ward, I almost got 50-50 amount of patients that get admitted, those with the vaccinated and unvaccinated. Unvaccinated one, they also have mild. None of them so far has ended up in ICU. So I never have any patient ICU as like previously. So yes, probably the cases are mild, but I mean maybe too early. But I think by now, I mean we have a lot of cases, so we could have been seeing a lot of them already in our ICUs. But so far there's none. So I think probably it's going to be mild. And I think probably that's going to be the trend of coronavirus going forward, that we still be, the coronavirus will be in our lives, but probably going to be in a milder form.
All right, maybe you can bring us into your confidence very quickly before we wrap. Has anything been said around the efficacy now of the vaccines against Omicron specifically? I mean, does it have a high efficacy in terms of the vaccines that we're taking, or is it a low efficacy? If you had to bring us into your confidence in terms of what you as doctors and scientists know, do we know anything that is concrete as yet?
I think the vaccine is very efficacious against the virus. And obviously, if you're vaccinated, you are in better position than somebody who is not vaccinated. So I would definitely recommend that everybody should get vaccinated immediately, and so that we can contain the virus, because this won't be the only variant. There are more to come. So maybe we need to get prepared and make sure that all the population are vaccinated for our safety of our own country and also for our economy.
We'll leave it there. That was a pulmonologist, Dr. Emmanuel Taban, just giving us the latest there in terms of just what the Omicron variant and how it's been affecting particularly children.